Hello, good morning. My name is Dr. Vikram Singh. I am consultant neurosurgeon at Orchid Medical Center. Today, I'll be talking about spinal injuries. Now, spinal injuries are a very common problem which is plaguing our society today. It is estimated that almost 10 in every 10,000 individuals, that is 1 in 1,000 individuals, suffer from a spinal cord injury in India. And these numbers are supposed to be very conservative estimates, so we can imagine what the real numbers might be. Uh, Apart from the numbers, another very important thing about spinal cord injuries is that it affects young individuals predominantly, especially through road traffic accidents or individuals who fall down from trees or from other kinds of heights while working. Spinal cord injury, since it involves younger people, younger sections of the society, it is much more serious than any ordinary injury. Uh, Another very important thing is that spinal cord injuries are generally in the neglected area, because when we talk about when the lay people talk about injuries, they seem to focus on head injuries and orthopedic injuries, that is fractures, dislocations, etc. But the topic of spinal cord injuries does not come up so often. In fact, in my opinion, spinal cord injury is far more serious than a head injury, in the sense that it leads to long term disability. And apart from reducing the quality of the life of the victim, it also reduces the quality of life of the caregivers and the people on whom that person is dependent. Now, coming to how a spinal cord injury happens. So, the spinal cord extends from our neck to our lower back. We have studied as a basic concept. So, there are multiple bones in the spine which are called the vertebra, and the spinal cord, which is a set of nerves, passes through a canal in these vertebra. And the spinal cord gives off nerves which subsequently go into our arms, our legs, controlling the power, the sensation in the arms and legs, as well as the abdomen and the chest. It also gives rise to nerves which control the power for urination and for passing stools. So what happens is, during a spinal cord injury, basically the spinal cord gets injured. How does this happen? This can happen either due to an injury to the bones or an injury directly to the spinal cord. The most frequent form which we observe is that during a high velocity injury, such as a road traffic accident or a fall from height, there is a fracture in one of these bones surrounding the spinal cord. Sometimes these fractures are very severe and they hurt the part of the spinal cord which is adjacent to the particular bone. In some cases, there may not be any bony injury, but the sudden movement of the spinal cord works as it's in fact called a whiplash injury, and it results to a damage to the spinal cord without actually causing any bony fractures. Now, whenever there is an injury to a spinal cord, there are two phenomena which happen. The first is the primary injury, the injury which happens at the time of impact, which leads to damage to the neurons within the spinal cord. Now, unfortunately, the primary injury, to a great extent, cannot be reversed via any surgery or medicine. What we can intervene, though, is secondary injury. So, after the primary injury, what happens is the spinal cord is usually under pressure, and different metabolic processes happen within the spinal cord, which cause further compression of the spinal cord, further damage to the neurons. So, it is this secondary damage that we focus on treating. The primary damage is subsequently treated via physiotherapy, and the body itself recovers over time. So, how do spinal cord injuries present? What are the signs? So, most often you will find a young individual who has fallen, has severe pain in the particular area of the spine. This area might be the neck, it might be the upper back, or it might be the lower back, depending on which area has been injured. Along with pain, he might complain of tingling sensation in the hands and legs. They might also have weakness, which is commonly known as paralysis. This paralysis can be of two types. When the spine is involved at the level of the neck, then in these cases we get weakness in all the limbs, the hands as well as the legs. This is known as quadriplegia. And in cases where the spine is injured below the neck, we get weakness of both legs. This is known as paraplegia. So this is a very common way of presentation. Other signs can be loss of sensation in the arms and legs, loss of control over urination, which is why very frequently the first thing which is done for such patients is to insert a urinary catheter so that urine can be drained out. So these are the ways in which spinal cord injuries can present. It is very important to note that pain as a symptom, I think there's a connection issue. Am I audible? Sorry for the interruption. So, like I was saying, there can be multiple signs, but it is very important not to ignore neck pain or pain in the back anywhere after an injury. The other way in which these injuries can present is after a long time. So many times, like I said, pain is the only symptom, and people neglect it. And later on, when they present to us, we find that they have a fracture in the spinal column, which has not been healed at time, which is united in an improper fashion and is pressing on the nerves, causing pain. So, in some cases, we do have a delayed presentation. Very importantly, spinal cord injury is also commonly associated with other injuries. So, because the mechanism is the same as for head injuries or orthopedic injuries, so frequently we see these people maybe having bleeding within their brain, or they may be having some different kinds of fractures or dislocations. So, it is very important to assess for those as well. Now the next question that obviously arises in people's minds is how do we come to know that there is a spinal injury? So, like I already said, the first thing is done via the symptoms and the signs, and uh, and a degree of suspicion which the doctors have. To further confirm this suspicion, we have different kinds of scanning techniques. So, the most commonly used scanning techniques are CT scans and MRI. Usually in spinal cord injuries, we need both CT as well as MRI. A CT predominantly looks at the bony component of the injury. It allows us to see the bones well, whereas the MRI helps us in seeing the spinal cord, the nerves which are arising from the spinal cord, and the discs which are present in between the bones with high definition. Apart from this, other investigations are also sometimes required. Sometimes X-rays are used to see whether the fracture is unstable. Sometimes we also do ultrasounds of the abdomen to see how much of a urinary issue there is and how much of urine is getting retained within the urinary bladder. Uh, so now coming to how do we manage such issues? What happens when a patient actually comes to hospital? So the first thing which is always done is to stabilize the patient. Like I said, they may be having many other injuries. First thing is that we check the vitals. It is very important that during transport, the patient should have a collar around the neck wherever there is a suspected neck injury. So what this collar does is during the process of transportation, it keeps the bones in an immobile condition so that the injury does not worsen further. It is very important to do this, and it is very important for medical technicians, for family members to know that this is necessary. Apart from this, once the scans are done, once we have stabilized the patient, we assess the scans. The first thing which we look for is whether the fracture is stable or unstable. So there are two different categories. Many times there are injuries to certain areas of the bone which do not lead to instability. Such injuries may not require any surgical treatment at all and just require immobilization for a small duration. In certain cases, the fracture may be unstable. By unstable, I mean just like a fracture in any bone of the body, the fragments of the bone are moving there and pressing upon the spinal cord. This is a dangerous situation, and this is where the role of surgery comes in. Now, again, the surgery varies depending on the region of the spine which has been affected. Before surgery, we also have various scoring systems based on which we decide whether a certain patient requires surgery or not. So, I'll not go into the technical details, but there are different scoring systems, such as we have S-lick system for the neck region, we have T-licks for the upper back and lower back regions to help us in deciding whether surgery is required or not. Now, in cases where surgery is required, it is recommended that it should be done within 72 hours. It has been shown that surgery within 72 hours leads to improved results, even in patients who have completely lost power in all the limbs. What we do during surgery is basically three things. The first thing is decompression. Decompression means we have to relieve the pressure on the spinal cord. This is done by removing a part of the bone which surrounds the spinal cord so that there is more room for the spinal cord to expand. The second thing which we do is fusion. Now, like I said, most of the cases in which surgery are required are unstable fractures. That is, there is movement in the fractures. So we need to reduce this movement. This is done by introducing rods and screws into the bones and fixing them so that this movement between the bones is cancelled out. Like I said, first is decompression, second is fusion, and the third important thing is deformity correction. Now, deformity correction means that in many cases after spinal injury, the normal alignment of the spine and the normal shape which it should have gets disturbed. This can have long-term implications and can lead to complications in the future. Therefore, when screws are put, we also adjust pressure on the screws in such a way that the original configuration of the spine can return. So these are the three steps which we do during surgery: decompression, fusion, and deformity correction. Uh, Now, there are different approaches to different regions of the spine. When we talk about the neck, it can be approached either from the front or from the back. In some cases, we need to do both surgeries. We need to fuse it both from the front as well as the back, depending upon the individual case. Similarly, in the upper back, we have approaches from the front, from the side, that is known as a lateral approach, as well as from the back. Most commonly, approaches from the back are preferred in this region. Similarly, for the lower back, that is the lumbar region, we can have approaches from the front through the abdomen, or from the side, which is a lateral position, or from the back. Again, most commonly we use positions from the back, which are known as posterior approaches. Apart from this, one very important thing I would like to tell the viewers about is the advent of minimally invasive spine surgery. So normally, spine surgery requires very big incisions, very big cuts through which surgery is done, and this leads to quite significant pain post-operatively. Minimally invasive surgery, on the other hand, is done through smaller cuts. So multiple small cuts are made through which the same results can be achieved. And there are many cases which are suitable for minimally invasive spine surgery, which is still very uncommon in India, but it is coming up in a big way. Apart from this, the most important thing after surgery is mobilization and physiotherapy. So just like it works for stroke survivors, similarly for spine patients, physiotherapy and regular limb exercise is very important. Apart from that, we also keep patients on certain medications. Patients who are completely immobile, have no movement, have no are completely bedbound, require blood thinners so that the blood does not clot in their limbs and lead to additional problems. So physiotherapy is very important. Uh, Finally, I would like to say that most people wonder what the prognosis will be like. What is the future going to be like for the patient? So the most important factor which decides what the future is going to be is the condition of the patient at the time of injury. So like I said, primary injury is very difficult to reverse. The degree of primary injury is the primary deciding factor. So for a patient who has completely lost power in all limbs, the prognosis, the future will not be as good as compared to someone who has lost power partially. That is very important to understand. Still, even in patients who have completely lost power, surgery is recommended in such situations because it helps in mobilizing the patient. Once we have fixed the spine, we can do more rigorous physiotherapy. We can make the patient seated in a wheelchair so that we can get the best possible result. But of course, the results are not as great as in patients who already have some preservation of power. So, to conclude, I would like to tell everyone that spinal cord injuries are frequently neglected, and very often delay in seeking treatment is what leads to poorer results. So, people should have greater awareness about such injuries. People should have greater awareness about the results of surgery and the requirements of surgery. Many times, people don't seek surgery thinking that such things are treatable by medicines alone, which is absolutely untrue. Raising this level of awareness in our society can help us in providing best results. Thank you. Okay, questions. So first question is from Antriksh Tiwari. How long does spinal cord injury take to show signs or symptoms? Okay. So like I said, most spinal cord injuries show their results immediately after the injury. So as soon as an accident happens, after that it will be noted that patient is not able to move their legs or arms, or is having difficulty in breathing, or is unable to pass urine or stool. So in most cases it happens immediately. In some cases, especially those which involve the lower back, the lumbar region, the injury may go neglected because the patient complains of only pain, and sometimes pain is a neglected symptom. In such patients, they may present after a few months saying that their pain is not going away, they have burning in both legs. Uh, so, so unless the injury is neglected, most of the times it presents immediately after the injury has happened. Next question is from Joginder Sani. It's what is the most common complication of spinal cord injury? So the most common complication is losing power in hands and legs. What is commonly known as paralysis is the most common complication. Apart from that, there are many other complications such as having difficulty in breathing in patients who have neck injuries, and losing sensation in hands and legs. But the most common would be paralysis. Other question is again from Joginder Seni. It's, can a spinal injury cause weight gain? So spinal injury directly does not cause weight gain. In fact, in most cases during the initial phase, because the patient's mobility is restricted, because the patient's diet changes, in most cases initially there is a weight loss, not a weight gain. Next question is from Deepak Kumar. Which medical center is one of the best center for spinal injuries treatment? Okay. So to this, I would like to say the center closest to you is the best center for spinal injuries treatment. So what is most important is to seek treatment at the correct time, not where you seek it. So as long you should identify uh, surgeons, neurosurgeons, orthopedic surgeons who operate for such conditions close to your place. And time is of great essence. Like I said, surgery within 72 hours leads to better results. So, whichever center is closest. This should be treated as an emergency. What are the two mainly commonly injured areas of the spine? Again, from Deepak Kumar. So, it's not just two, there are many areas which can be injured. Uh, the most common among these are the cervical spine, that is the neck, this region, and the second is the dorsolumbar region, that is the middle back. So these are the most common areas where fractures happen. Next question is from Rajaji. What are the symptoms of a spinal injury? So I think I've already talked about this. Uh, just to summarize again: pain, tingling in hands and legs, losing power in hands and legs, that is paralysis, losing sensation in arms and legs, loss of control over urination. These are the most important symptoms of a spinal injury. Uh, again, from Rajaji, what are the types of spinal injuries? What are spinal cord injuries? I think I've answered these already. How do you diagnose spinal injuries? So again, like I said, using first thing is clinical suspicion. By seeing the patient, we suspect that there is a spinal cord injury. Apart from that, we use CT scans and MRI to diagnose the exact area of injury and the exact degree. Uh, Ashish Sharma, where is your hospital located? Our hospital is Orchid Medical Center. It is located in Ranchi on HB Road. And currently we are doing all kinds of spine surgeries. Again from Ashish Sharma, does excess gymming lead to spinal injury? Yes, excess of anything can lead to injuries. However, it's important to realize that more commonly, uh, what overexertion in the gym leads to is a degenerative spine injury. What it causes is for the discs in between your cervical spine or the lumbar spine to come out, which I have not talked about because it does not come under the category of spinal cord injury. It is a degenerative disorder. But yes, to answer your question, lifting heavy weights suddenly can lead to problems in your back as well as neck. What are the three key signs and symptoms of a spinal injury? Again, I think I have answered this already. Antariksh Tiwari asks, how does spinal cord injury affect the brain? So this is a nice question. So an isolated spinal cord injury does not affect the brain directly. But what is important to understand that these injuries occur together frequently. So it is very common that a patient might be having a brain injury, a bleeding within the brain, is unconscious because of it, and at the same time has an injury in the spinal cord as well. So this also happens many times. So the brain injury does not happen because of the spinal cord injury. What happens is that both have occurred together at the same time because of the same event. Uh, in such situations, obviously, the treatment of the brain injury takes precedence and is more important to do before coming to the spinal cord injury. Uh, Next question is by Aparna Sharma. By what stipulated time injury should be rectified before it degenerates? Again, a very nice question. The ideal time is as early as possible, and what studies show is that doing such surgeries, correcting the alignment of spine within the first 72 hours, gives much better results than doing it after that. So, as early as possible, I would say. Antariksh Tiwari asked, what is the most serious type of spinal injury? So the most serious type of spinal injury is called a complete cord transection. So what happens in this injury is that the spinal cord gets completely cut through and through. So till now I was talking about conditions in which spinal cord gets compressed. Uh, However, when it's completely cut, the results are very poor, and even with long-term physiotherapy, recovery is not expected in most cases. So that is the most serious spinal injury. And Antariksh Tiwari asked, how do most spinal cord injuries occur? So most spinal cord injuries occur during road traffic accidents, and second most importantly, fall from height. So very commonly we see construction workers who are building uh, floors and they fall down from different floors of the building. People who are wood cutters or people who climb up trees for a daily living, and they have fallen down from a particular branch. So these are some of the most common mechanisms through which spinal cord injuries happen. Uh, any other questions? I think I've finished all of this. I think I've finished all the questions. Any other questions? I think. I think it's done. Okay, thank you very much.